The four main types of shock. Cardiogenic shock is the result of the heart being unable to supply adequate blood circulation to the vital organs, resulting in an inadequate supply of oxygen and nutrients. Obstructive shock is caused by some type of obstruction to blood flow, usually within the blood vessels, such as pulmonary embolism. Hemorrhagic shock, also known as hypovolemic shock, is due to a severe lack of blood and fluid within the body. It results from blood loss, either through external or internal bleeding, which causes a decrease in total blood volume. Distributive shock refers to any type of shock caused by inadequate distribution of blood either in the blood vessels or throughout the body, leading to inadequate volumes of blood returning to the heart. The early signs and symptoms of shock are apprehension and anxiety, slightly lower body temperature, rapid breathing, slight increase in pulse rate, normal or slightly decreased blood pressure, pale, ashen, or cool skin. Later signs and symptoms of shock: confusion, slow, shallow, irregular breathing, decreasing blood pressure, rapid but weak and irregular pulse, pale, cold, and clammy skin, lower than normal blood pressure, dilated pupils that are slow to respond to light. How to care for shock. Since you may not be sure of the patient's condition, leave him or her lying flat. Elevate the person's feet about 12 inches unless head, neck, or back is injured or you suspect broken hip or leg bones. If the person is not breathing or breathing seems weak, begin CPR. Treat any obvious injuries. Take steps to control any bleeding if present and prevent further blood loss. If you see any broken bones or dislocated or damaged joints, immobilize them to prevent movement. Broken bones or dislocated or damaged joints can cause more bleeding and damage. Keep the patient warm and comfortable. Cover the patient with a blanket to prevent loss of body heat. It is important not to overheat the patient. Your main goal is to keep the patient's body temperature normal. Lastly, follow up and call for more medical assistance.